Welcome to the first episode of Second Inning, Stronger Than Before, a space where we dive into real stories, inspiring journeys, and voices you need to hear.
Every once in a while, you meet a person whose presence just sticks with you. They bring not just the passion, but a sense of purpose.
Today, we have with us a very special guest, Dr. Kasturi Bhattacharjee.
Thank you, Swastika, so much for having me here. I was not knowing that I'll have to sit here with my two beautiful friends. Kindu moi bhabi, so I'm sure that they want me to share my journey. And let's go ahead and let's hear from each other.
Well, Dr. Kasturi, Sri Sankaradeva Nethralaya is one of the finest and a center of excellence for eye care. ये इतना बड़ा नाम हो गया है पूरे वर्ल्ड में. I think people know about Sankaradeva Nethralaya in Guwahati. Did you ever think this would become such big?
Yes, you have started with a very nice line. ये इतना बड़ा नाम हो गया. I think this Sankaradeva Nethralaya has today become one of the, I should say, the state-of-the-art eye care center for the whole of the people of Eastern India is because the trust that we have received from a patient. So it started as a very small hospital way back in 1994, and this is the brainchild of Dr. Bhattacharjee, who is also my husband. So when we started with only 4 patients, but interestingly, today we have more than 1200 to 1400 patients.
In a day?
Yes, approximately, 1200 to 1400. So when it started, actually, this is the main vision and mission of my hospital. Keteba to my husband like eneke kon that this is your first child.
Yes.
Like we have got 2 daughters. So when he started, we had the day one, we had just 4 patients. And ami bhabisalo ami parim ne noarim. Kintu lahekoi jetia ami decide korlu je what actually the main requirement, hetu homoy maximum patient or patient southot gusi gosil. For any eye care, they used to go to the south. Why? Because the facilities are good, the instruments, but technology is good. So tetia amar hospital bahut manu ahile bahut help korile. We got help from Tata Tea, we got help from government of Assam, government of India, the Northeast Council, so we amak help korile. They have donated, and then we got the state-of-the-art instruments. We brought all the technology, and the best thing, we have really trained up the doctors very well.
So then you decided ki eneko ekhon hospital amar ohomotut birat dorkar. When you saw patients are all the way going to Chennai for their treatment, and then you really decided amar ekhon hospital eneko dorkar Guwahati.
And it's very important karon ejon manuhor jikone eta jete bemar hoy, the whole family is affected. Aru jodi kapar eta treatment to kane ohomor pa Delhi jao ba Chennai jao ba Bangalore jao, the whole family kiman eta effect mane অসুবিধা হৈ যায়. So আমি হেটিও ভাবিলো যদি আমি গুটে ফেসিলিটি খিনি ইয়াত আনিব পাৰো, not only in terms of technology but also train the doctors, and doctor এটা খুব important assistance is the paramedical force. So to train up the paramedical force, when we train everyone and we train in such a way that there should be no compromise in quality, and then we could give the results to a patient, and we got the trust, we got the faith in the patients, and today I'm happy that it has been declared as a center of excellence by the then Prime Minister of India.
They are all done in your, there's an in-house training.
Yes, we have an in-house training because we have also lots of academic programs like Amai to Postgraduate Center Hoy. It started in 1994. Postgraduate Center started in 1997. And first batch of postgraduate pass course in 2000, and a postgraduate under the government of India, Ministry of Health, a diplomat of National Board buli koy. And tar upor to ami bahut kisman research koru, training koru, and I'm so happy to share you that aji dinot, if you see doctors not from Assam or Northeast are coming here for training, doctors from Delhi, Bangalore, Chennai, Mumbai, Gujarat, any places, they come here to Assam to have the training here, because kisuman surgery, kisuman procedure that we are doing it, maybe this is happening first time in India or maybe first time in the world, and so it's very nice.
It's big, it's commendable. Actually, everyone, many doctors coming to Guwahati and getting themselves trained, it's a very It's what you said.
মানে কি জানা এইখানে এটা খুব ইন্টারেস্টিং কথা কওঁ আই ফিল ছ' হেপী ইউ ন' লাইক যেতিয়া মই এবাৰ বম্বেত গৈছিলোঁ বহুত বছৰৰ আগত তেতিয়া মোক সুধিছে মই যেতিয়া লেকচাৰটো দি আছোঁ আপ কাহা চে আয়া মই কৈছোঁ গুৱাহাটী তেতিয়া মোক সুধিছে গুৱাহাটী কাহা হে এনেকৈ মানুহে প্ৰশ্ন কৰিছিল কিন্তু আজি উইদিন দিছ 1.5 to 2 decades it is taking a reverse flow.
Yes,
So
we have patients from everywhere coming down to Guwahati.
Yes.
Acha, eta interesting question eta khudo. Sri Sankaradeva Nethralaya, the name itself signifies everything. Mahapurukh Srimanto Sankaradevor namor te rakha hoise. So who decided the name?
My husband. তাৰ মানে যেতিয়া এই হস্পিটেলখন ষ্টাৰ্ট কৰিছিলোঁ তেতিয়া আমি ভাবিছিলোঁ যে দিছ হস্পিটেল ইজ ফৰ আছাম ফৰ দ্য পিপল অফ আছাম আৰু অসমৰ এজন বৈষ্ণৱাইট চেইণ্টৰ নামত যদি আমি ৰাখিব পাৰোঁ মহাপুৰুষ শংকৰদেৱ নেত্ৰালয় চ' তেতিয়া আমি ভাবিছিলোঁ যে আমি তেওঁৰ নামত ৰাখোঁ কিন্তু সেই ইংৰাজীত শংকৰদেৱ নেত্ৰালয়টো আমি কেনেকৈ লিখোঁ চ' উই হেভ টেকেন মানে বহুতৰ অপিনিয়ন ল'লোঁ ইভেন মিষ্টাৰ লেট দেৱেন দত্তকো আমি সুধিছিলোঁ যে আমি কেনে বানানটো কি হ'ব লাগিব তেতিয়া তেওঁ ক'লে যে এইটো SRI শ্ৰী শংকৰদেৱা নেত্ৰালয়
Sankaradeva Nethralaya.
চ' যাতে বানানটো শুদ্ধ হয় মানুহে যাতে বুজি পায় সেইকাৰণে এই নামটো শ্ৰী শংকৰদেৱা নেত্ৰালয় হৈ গ'ল আৰু আজিকালি আমি শ্বৰ্ট ফৰ্মত কাৰণ বহুত দীঘল নাম হৈ গ'লতো সেইকাৰণে আমি SSDN বুলি কওঁ
Okay. So you say that Sankaradevor philosophy reflects in your work, in the hospital work.
একচুৱেলি কি জানে তেওঁ এটা ফিলচফি আছিল কৰ্মই ধৰ্ম আমি সেইটোৱে ফ'ল' কৰিছোঁ আৰু সেইটো ভাবিয়ে 1996 আমি ফাৰ্ষ্ট ৰুৰেল তাৰমানে কমিউনিটি এক্টিভিটি ষ্টাৰ্ট কৰিছিলোঁ আৰু তেতিয়া আমাৰ গভৰ্ণৰ আছিল লেট মিশ্ৰ
Loknath Mishra.
লোকনাথ মিশ্ৰ আছিল তেওঁ এই কমিউনিটি আমাৰ গোটেই উইংটো অ'পেন কৰিছিল এণ্ড উই ষ্টাৰ্টেড ইনিচিয়েলি উইথ গোয়িং টু দ্য ভিলেজ আই কেম্প কৰিলোঁ কেম্প কৰি পেচেণ্ট আনিলোঁ অপাৰেশ্যন কৰিলোঁ and in fact ebar government of India not only for Assam for the whole of the northeast ami kori ahisu in fact ebar ami gote Nagaland goi amar hospital team goi Nagaland jiman paru we had screened the patient for cataract is the most common cause of mane avoidable blindness so ami teoloko doctors train korisu tat go operation korilu kine etia we have changed the system mane we have adopted 2104 village ohomor iman village losu আৰু ইয়াতে এটা ভেৰি ইণ্টাৰেষ্টিং কথা আছে মানে উই আৰ ট্ৰাইং টু হোৱাট টু চে টেক দ্য লোকেল বাইণ্ডছ যে তাৰমানে লোকেল মানুহ আমি ট্ৰেইন কৰিছোঁ দে আৰ হেল্পিং আছ ইন দিছ প্ৰজেক্ট উই আৰ গিভিং দেম দ্য জব অপৰচুনিটি এলং উইথ টেকিং কেয়াৰ অফ দ্য আই এণ্ড অলছ' মেকিং এ ভেৰি ছাষ্টেইনেবল প্ৰজেক্ট আৰু এই বস্তুটো আমি যেতিয়া ষ্টাৰ্ট কৰিলোঁ উই ৰিয়েলি ৱান্টেড টু ন' মানে হাউ দিছ প্ৰজেক্ট ইজ গয়িং অন তেতিয়া we have invited the professors, the students of Wharton Business School, USA.
Okay.
So তেওঁলোকক আমি মাতি এটা impact analysis কৰিব দিলোঁ impact analysis in terms of eye care, impact analysis in terms of quality eye care and also about the economic impact. So তেওঁলোকৰ বহুত কিজন মানুহ আহিলে আহি তেওঁলোকে গাঁৱত গ'ল ফাৰ্ষ্ট আমাৰ প্ৰজেক্টটো সোণাপুৰত ষ্টাৰ্ট কৰিছিলোঁ বিকজ সোণাপুৰ ইজ জাষ্ট এৰাউণ্ড 50 কিলোমিটাৰ্ছ ফ্ৰম হিয়ৰ এটা ছেমি আৰ্বান যাতে গাড়ী চাৰিও যাব পাৰে সেনেকৈ আমি সোণাপুৰত ষ্টাৰ্ট কৰিলোঁ এণ্ড তেওঁলোকে ইমান ভাল ৰিপৰ্ট এটা দিছে এই ৰিপৰ্টটোত মানে কেনেকৈ মোৰ এটা একচুৱেলি এনালিচিছ এটা মনত আছে মানে তেওঁলোকে কৈছে যদি এটা মানুহ 60 ইয়াৰ্ছত যদি কেটৰেক্ট হয় এণ্ড কনচিডাৰিং ডেট তেওঁ 75 ইয়াৰ্ছলৈকে বাচি থাকে চ' তেওঁ ইকনমিক ইম্পেক্ট দ্য ইকনমিক what to say growth will be more than around 12 to 15 lakhs যদি হেনুকা এটা ক্যালকুলেশন কৰিছে বা বাচ্চা এটা 18 বছৰ বয়সৰ বাচ্চা এটাক যদি কিবা কথাত অন্ধ হৈছে আৰু তাক যদি if we can give back the vision দৃষ্টি শক্তি যদি ঘূৰাই দিব পাৰো as the child grows he'll become a productive person become a very productive citizen of the society he চাকৰি কৰা ষ্টাৰ্ট কৰিব so তাৰ economic growth will be something around 50 lakhs so এই ৰিপৰ্টটো তাৰছত World Health Organization WHO আছে now WHO the whole model আমি যোনটো ষ্টাৰ্ট কৰিছিলোঁ this model they want to use it but we are trying to collaborate with us এটো Assam model হ'ব so along with government of Assam আমি গোটেইখিনি কৰি so that it can be used by the other countries where they are doing community work so that they can reach every unreached that means the last man in the last mile তাৰমানে what I believe বা আমাৰ hospital philosophy is always inclusive growth growth cannot be limited only to the urban section. Growth cannot be limited to the privileged people. It should be reaching to everyone in the society. Only if we can reach the unreached, তেনেহ'লে এটা লাইফটো যেন কিবা ফুলফিলিং কিবা এটা কৰি
Yeah, but affordability ৰো কথা আছে for them.
No, all these patients যোনবোৰ গাঁৱৰ পৰা যে আনো আমি তেওঁলোকক টোটেলি ফ্ৰী অফ ট্ৰিটমেণ্ট দিওঁ আৰু
To everyone.
To everyone যাক আমি স্ক্ৰিন কৰোঁ যাৰ কেটৰেক্ট হৈছে বা কিবা মানে ট্ৰিটমেণ্ট লাগে আমি আমাৰ বাছ পঠাই দিওঁ আমাৰ ডক্টৰ আমাৰ পেৰামেডিক্স যাব তেওঁলোকে চাব বা কেতিয়াবা ডক্টৰো যায় সেই পেচেণ্টবোৰ আনিব আনি আমাৰ হস্পিটেলত ৰাখোঁ খুব ধুনীয়াকৈ ৰাখোঁ চাই খুব ভাল লাগে সিহঁতক তাৰপিছত খুব ভালকৈ মানে খানা চানা দিওঁ
তোমালোকে যেতিয়া ফ্ৰী কৰা how do you decide কি he is eligible for a free surgery?
Decide on his মানে আগেতো আমি চাইছিলোঁ তোমাৰ এখন হেৰি দিছিল ন বিল' পভাৰ্টি লাইনৰ এখন দিছিল আৰু কেতিয়াবা গাঁৱৰ যোনজন মৌজাদাৰ বা গাঁওবুঢ়াই যদি লিখি দিয়ে যে তেওঁ কৰিব মানে নোৱাৰে হিজ মাছ বিল' দ্য পভাৰ্টি লাইন তেনেহ'লে আমি
So they are eligible.
Yes.
So it's a mission that everyone possible अपनी आँखों से दुनिया को देखे.
Definitely. It is, I think vision is a right of every individual. Sight is a right. Right? কিন্তু এটা খুব ভাল লাগে জানা যেতিয়া তেওঁলোকক আমি ট্ৰিটমেণ্ট দিব পাৰোঁ দৃষ্টিশক্তিটো ঘূৰাই আহে যেতিয়া পৃথিৱীখন দেখে ন ডেট হেপিনেছ ইন দেয়াৰ ফেচ মানে সেইটো দেখিলে যে নিজৰে মানে oh my god the day is done মানে ইমান বেছি ভাল লাগে.
Dr. Kasturi, tell us why eyes? You skipped the other body parts, the brain or maybe the bones and you ended up with eyes. What drew you to eyes?
Yeah, that's very interesting. Tamane, I think you all will agree the eye is the gateway to every organ of the body. So sokutu enukata structure like যেতিয়া আমি চকুটো চাওঁ you can actually see what is happening in other parts of the body. Blood to কেনেকৈ flow কৰি আছে like skinত অলপ blood to কেনেকৈ flow কৰিছে we don't see. কিন্তু চকুটো যেতিয়া we dilate and with our own naked eyes we can see how the blood is flowing. Cellsবোৰ কেনেকৈ গৈ আছে the nerve we can see the nerve and this eye is considered as an extension of brain. So a nerve to কেনেকৈ functioning. So this really fascinated me. And not in a lighter sense more যদি কওঁ the eye is something which can speak which even the lips cannot whisper. Right?
Yeah, you can
They are very
speak
expressive.
volume.
Yeah, so this eye is something the most important organ of the body. Like from the eye it looks small but it's the most vast subject I should say because it is connected to everything be it bone be it heart be it kidney be it liver everything is connected. Yeah, love at first sight multiple
Such
ways.
a tiny organ and you know such a tiny organ and very complicated.
Yes, and it's so small you have to be a perfectionist.
Yes, absolutely.
Like
And this is the gateway of what we see, the beautiful things, maybe what's happening. Everything is through the eyes.
exactly.
Yes. To me, MBBS Korila, NIT PG, and then MS Ophthalmology, and then super specialty. Which was the toughest?
মোৰ ভাল লাগিছিল মই যেতিয়া মই actually I have done double post graduation এটা অসমৰ পৰা কৰিলোঁ এটা তোমাৰ দিল্লী নেশ্যনেল বৰ্ডৰ পৰা কৰিলোঁ
Both ophthalmology.
yes ophthalmology তাৰপিছত মই যেতিয়া ডিচাইড কৰিলোঁ যে মই গুৱাহাটীত থাকিম I will work in Sankaradeva Nethralaya তেতিয়া মানে আমাৰ যোনজন চেয়াৰমেন তেতিয়া মোক কৈছে ৱেলকাম টু Sankaradeva Nethralaya the hospital having international standard মোৰ এতিয়া মনত আছে. Then the question came to me, Hosaiki international standard niki? Why don't I try and check whether this hospital really has an international standard or not?
Okay.
So তেতিয়া মই বহুত চালো মই কি কৰিলে what is the international exam that I can sit for? So তেতিয়া গম পালো যে there is FRCS. আৰু সেইটো সময়ত মানুহে যেতিয়া FRCS কৰে মানুহ সেইটো সময়ত গৈ UKত থাকে 2-3 বছৰ থাকে আৰু তাৰপিছত পৰীক্ষাটো দিয়ে. কিন্তু মই ভাবিলোঁ যে মোৰ যি ট্ৰেইনিং অসমত হৈছে মই যি ইয়াতে শিকিছোঁ whether the training in Assam is as per the international standard or not. সেনেকৈ মই ডিচাইড কৰিলোঁ যে মই UK যাম আৰু ডাইৰেক্টলি FRCS পৰীক্ষাটো দিম. So even my husband said, no, তই নাযাবি, you don't go because মানুহৰ এটা ভাল ফিলিং আছে that you are a double postgraduate and যোনটো DNB বুলি কয় I'm the first one from Assam আৰু to pass কৰিবলৈ দেই. তেতিয়া মই মোৰ নিজকে মনত প্ৰশ্ন কৰিলোঁ অ'কে মই যদি যাওঁ FRCSটো দিওঁ যদি মই ফেইল কৰোঁ মানুহে কি ক'ব যে শ্বি ইজ নট গুড, অলপ ডাম্প, আৰু যদি পাছো কৰোঁ শ্বি ইজ ব্ৰাইট, বাট মোক কেতিয়াও এফেক্ট নকৰে মানুহে ছেইং ৱেডাৰ আই এম গুড অৰ ৱেডাৰ আই এম বেড, বাট দ্য কিউৰিয়চিটি উইদিন মি আই ৱান্টেড টু ফাইণ্ড আউট। চ' মই সেনেকৈ গ'লোঁ, মই এডিনবৰা গ'লোঁ, এণ্ড দিছ ইজ মাই ফাৰ্ষ্ট ভিজিট টু UK। মই যেতিয়া গ'লোঁ এডিনবৰাত, and it's a tough examination, really tough. To me, first a theory দিব লাগে, there were approximately 262 candidates from all over the world. So তুমি theory pass কৰিলে boardত আহি যাব নামকেইটা, then you sit for the orals pass কৰিলে then you have to sit for the clinicals, and last দিনাখন তোমাৰ এটা because eye is an extension of brain, মই কৈছোঁ সেইকাৰণে neuro ophthalmology এটা special exam দিব লাগে। So ultimately from 262 61 পাছ কৰিলে। চ' ডেট ৱাজ ৰিয়েলি টাফ, বাট মোৰ ইমানেই ভাল লাগিছিল। এণ্ড এইখিনিতে মই এটা কথা শ্বেয়াৰ কৰোঁ, মই যেতিয়া ফাৰ্ষ্ট টাইমত পাছ কৰি গ'লোঁ ন, তাৰপিছত এটা এক্সামিনাৰ মোক সুধিলে যে হাউ মেনি ইয়াৰ্ছ ইউ হেভ বিন ইন UK। মই তাক ক'লোঁ যে দিছ ইজ ফৰ দ্য, মই তেওঁক ক'লোঁ মানে দিছ ইজ ফৰ দ্য ফাৰ্ষ্ট টাইম আই হেভ কাম টু UK। তেওঁ শ্বকড হৈ গ'ল। তেতিয়া তেওঁ কৈছে দিছ ইজ মাই কাৰ্ড, ফ্ৰম টুমৰো ইউ কেন ৱৰ্ক ইন মাই ক্লিনিক বিকজ নাও ইউ ইন FRCS। মোৰ খুব ফুৰ্তি, কাৰণ ফুৰ্তি এইকাৰণে লাগিছিল এট ডেট টাইম মই শংকৰদেৱ নেত্ৰালয়, মাই চেলেৰী ৱাজ অনলি 28,000 পাৰ মান্থ। এণ্ড তাত যেতিয়া মই কেলকুলেট কৰিছোঁ, অ' মাই গড, মোৰ এখন মান্থলি এৰাউণ্ড 2 lakhs মান হয়, এপ্ৰক্সিমেটলি 45 to 50 lakhs মান হয় মানে। অঁ, মই খুব হেপ্পী আৰু। তাৰপিছত মই ফাৰ্ষ্ট মোৰ হাজবেণ্ডক ক'লোঁ, মোৰ হাজবেণ্ডে কৈছে ন' টেক দ্য নেক্সট ফ্লাইট এণ্ড কাম বেক এণ্ড ৱৰ্ক ফৰ দ্য পিপল অফ আছাম। মাক ক'লোঁ, মায়ে সেইটো ক'লে। এণ্ড এনেকুৱাই মই আছিলোঁ মানে এনেকুৱা হয় কি আই মেট মাই হাজবেণ্ড ৱেন আই ৱাজ কুৱাইট য়াং, বাট তেওঁৰ কথা মই পেলাব নোৱাৰোঁ। হি ট'ল্ড যে টেক দ্য ফাৰ্ষ্ট ফ্লাইট এণ্ড কাম বেক এণ্ড ৱৰ্ক ফৰ দ্য পিপল অফ আছাম। বুজিছা, মোৰ ফ্লাইটটো আছিল 3 দিনৰ পিছত, আৰু মই য'ত আছিলোঁ মোৰ প্ৰিন্সেছ কেচেলটো জাষ্ট নেক্সট টু মাই বিল্ডিং। মই ভাবিছিলোঁ পৰীক্ষাত পাছ কৰিলোঁ মই সেইটোও চাই আহিম, কিন্তু তেওঁতো ক'লে যে টেক দ্য ফাৰ্ষ্ট ফ্লাইট, এণ্ড এক্সেক্টলি ডেট ডে অনলি আই টুক দ্য ফ্লাইট। তেতিয়া মানে মোৰ হাতত আৰু 3 pounds আছিল। এনেকৈ ফ্লাইটটো লৈ পেলাই আহি পেলাই গুৱাহাটী।
You don't regret coming back, I'm sure.
I don't regret, sincerely.
And did you ever had a backup plan, like if not eye doctor then?
Not exactly, but if you ask me, supposing to me ophthalmology seat napala tenehole ki korilaten, definitely pediatrician. I love spending time with the children. ইহঁত ইমান ইন'চেণ্ট এণ্ড ইমান মানে ইহঁতে তোমাক ইমান হেপ্পী কৰি ৰাখে ইণ্টাৰেক্টিং উইথ দেম। ডেফিনেটলি থাকে চাগে মই পেডিয়াট্ৰিচিয়ানে হ'লোহেঁতেন।
You are the first doctor in your family নে আৰু আছে?
No.
তুমি প্ৰথম?
নহয়।
Okay.
মাই ছেকেণ্ড চিষ্টাৰ, তাই নেফ্ৰলজিষ্ট, ডক্টৰ মঞ্জুৰী শৰ্মা। তাই এতিয়া গুৱাহাটী মেডিকেল কলেজৰ নেফ্ৰলজি হেড।
Is it oculoplasty or oculoplasty? What is the correct way of saying it?
Yeah. Oculo means eye, so any plastic work around the eye is oculoplasty. এটো নহয় যে অকল চকুৰ ওচৰত, তাৰমানে you can see like eye and adnexia ক'লে হ'লে তোমাৰ lid এই গোটেইখিনি। And if you see the muscles, the face as a whole, everything is connected to the eye. The eye is the center of the face. So when we do any of the plastic procedure, we cannot concentrate here. We have to think holistically the whole face. Like whole face starting from the forehead to the chin and from ear to ear. So that is what we deal with. But it is not only plastic, mane bhaibe oh okol cosmetic or something. It is not. It reconstructive, repair, kiman accident case ahe, kiman trauma case ahe, lid sit phati jay, sugur pata to phati jay, that you need to repair. And repair means you have to give them a very nice aesthetic correction, because moi hodai kaun all aesthetic work is what to say includes a functional point to it. Like তুমি function dibole তুমি bhalke aesthetically correct koribo laibo. We also do lots of cancer reconstruction. বহুত মানুহৰ cancer হয়, lead to কেতিয়াবা এনেকুৱা হয় যে cancer to কাটি গুটে lead to গুছাই দিবলগীয়া হয়. It can happen even in a child, 1-day-old child also, and depending different types of cancer. কিছুমান চকুৰ ভিতৰত হয়, কিছুমান লিডত হয়, বা কিছুমান এই বগা যোনখিনি আমি স্ক্লিৰা বুলি কওঁ বা কনজাংটিভা কওঁ তাতো হয়। So this is basically a plastic reconstructive repair and aesthetic correction of whole of this periocular region.
So is it difficult to make people understand that what is oculoplasty? Because it's a new word for them. So sometimes they might ask you, "Okay, what is this? What is oculoplasty?"
Yeah, the name
And
itself is
and
very.
does it define? It doesn't define, like as you have said, it doesn't define to any age group or any special issues. So
Yes, এইটো কিন্তু হয় মানুহে ভাবে যে চকু ডাক্তৰ মানে খালি কেটৰেক্ট সাৰ্জন টু বি ভেৰি
Exactly, yeah.
আৰু কেটৰেক্টৰ পৰা আজিকালি মানুহে অলপ ডায়েবেটিক ৰেটিনোপেথি জানে ডেট এৱেৰনেছ অহা নাই কিন্তু প্লাষ্টি ইজ ভেৰি চেলেঞ্জিং এণ্ড এভৰি কেছ ইজ ডিফাৰেণ্ট ইট ইজ নট এ ৰিপ্ৰডিউচিবল চাৰ্জাৰী যদি ইফ ইউ আস্ক মি এ কেটৰেক্ট চাৰ্জাৰী আমাৰ ডিফাৰেণ্ট ষ্টেপছ আছে এণ্ড লাইক দিছ ইজ এ ৰিপ্ৰডিউচিবল চাৰ্জাৰী মই যিয়ে কৰোঁ মাই জুনিয়ৰ কেন ডু এক্সেক্টলি দ্য ছেইম But plastic is every case is different, and moi hodai etue believe koro like this is a specialty which helps you get the dignity back. This is a specialty which enhances the self-esteem of a patient. Karan ketiba enuka hoy je manu eta ki hol je jonmogoto bhabe gote potatu pori ase. And socially by everything it's so disturbing for him no so beta kode ki enega sukutu enega nami hise so we correct that also and he to correct pisot jeta teolike normal look eta pai no the confidence that we see in them so this specialty helps you regain the confidence regain the self esteem and most important the dignity of a person
তুমি তো বহুত কনভিকশনেৰে কাউন্সেলিং কৰিব লাগে তেতিয়াহ'লে পিপল উইল yeah so people often confuse this with plastic surgery or it's a cosmetic surgery, right?
It is also a oculoplastic or multiple colonial reconstruction repair also cosmetic is also part of it you know interestingly মানুহে আজিকালি কি কয় সবে botox to খুব জানে if you really ask laser জানে কিন্তু in medical profession botox কোনে first start কৰিছে it was started by an eye doctor laser কোনে start কৰিছে it has been started by an eye doctor so it not that I'm telling you it has got all this both functional and aesthetic goes together like মানুহে অকল এটো নহয় যে মই কল plastic means aesthetic no plastic means you have to give him the function back also
Reconstructive.
yes it is reconstructive also.
how much time does one surgery takes?
Depends. You know, there are some surgery which may take you 4 or 5 hours and usually plastic like oculoplastic surgery takes you around 1 to 4 or 5 hours also. This one patient tumalke sapason eta khub common disease thyroid eye disease boli kaun thyroid iman beshi hoise so ketiba ki hoy sokoto endom ulai jay.
What do you call that? Thyroid eye disease?
Eye disease.
So thyroid can affect the eyes also?
Yes, and if it affects, it really affects very bad. One especially
blindness?
It can lead to blindness. Jihetu this is a public forum, I should say, I'm giving a message to the public that kunba jodi thyroid patient ase never smoke or never take any nicotine, anything like this because this really leads to severe eye problem which can lead to blindness. কি হ'ব গুটে চকুটো উলাই যায় তা মাসল ডাঙৰ হৈ যায় ফ্যাট ডাঙৰ হৈ যায় মেইন নাৰ্ভটো কম্প্ৰেছ হৈ যায় এণ্ড মানে সম্পূৰ্ণভাৱে নেদেখা হৈ যাব পাৰে সো দোজ আৰ সাম ইমাৰ্জেন্সি সাৰ্জাৰী তেতিয়া আমি কি কৰোঁ ফ্যাটবোৰ গুচাব লাগে অলপ হাৰ্ডিবোৰ অলপ গুচাই স্পেচ দিব লাগে টু পুশ বেক দ্য আই কেতিয়াবা দুটা চকু একেলগে কৰিবলগীয়া হয় সো ইট মাইট টেক এৰাউণ্ড 6-7 hours একচুৱেলি হেল্ডি ৱে অফ লিভিং হেল্ডি লাইফষ্টাইল বহুত বেমাৰৰ পৰা মানে দে প্ৰটেক্ট ইউ ইটছ ভেৰি ইম্পৰ্টেণ্ট কিন্তু আমি খুব casually thinking it's a very fashionable word healthy lifestyle but it is really important.
Are you the only oculoplastic surgeon or expert in Northeast India na ase ajikali kore?
I think I am the first one to do full of oculoplasty, first one to be a trained oculoplasty surgeon besides being trained in India moi America ba bahut tight training loisu because this is a specialty which deals with learning unlearning, relearning. Right. So you have to learn and relearn and every day is a new day, every case is challenging, every case is different. So it needs lots of hard work, lots of patience and one should be really passionate. Eto nohoy je moi just kori disu no because whatever surgery you do today after you may say because manohor tissue reaction is different you may have to repeat it. So you need lots of patience and you should be really dedicated.
Oculoplasty is a very unique and challenging field. You know, one uncommon specialization koribo para young doctors ok. Tumi kiba any piece of advice you would like to give, a message to them?
Yeah, definitely. I think more the young doctors, you never follow the crowd, follow the curiosity. You have to follow what the heart says. But you should be really very dedicated and you should have patience. Moi to age koisu kan itu no when I do cataract surgery, I also head the cataract surgery department in my hospital. So cataract kori iman bhal pao. Ami 25-30 cataract kori diu because cataract takes approximately 20 minutes or 10 to 20 minutes. But plastic takes hours. And also healing is so different. So you should know, like, before taking this up, and this is not I should say not a very glamorous profession also, but this gives a peace of mind.
Before the doctor journey, there was basketball. Tell us about that phase. Who got you into basketball?
Basketball actually started, I studied in St. Mary's Convent Guwahati, Chenikuti je ase tat. Amar dhuniya basketball court asil ami khelisilo. Tasar ebar mor ejon senior kose je why don't you go and go to the stadium, tat besi better trainer ase, better coach ase. So heneke mo goisilo. Kintu my parents always wanted, especially mor deuta mane no to pohibo lage. So ekdom mone mone polai khelibole goisilo. খেলাৰ পিছত তাৰপিছত লাহেকৈ মই নেশ্যনেলছ খেলিলোঁ. I represented the state নেশ্যনেলছত খেলিলোঁ. So very interestingly এনেকুৱা হৈছিল যে এটা সময়ত মই ভাবিছিলোঁ যে মই লাইফটো এনেকৈ ল'ম, মানে যে মই খেলা চেলাই কৰিম. So কিন্তু মই যেতিয়া মই ক্লাছ 10 পাছ কৰিলোঁ, my result was pretty good. My মা এইখিনিতে মই ইণ্টাৰেষ্টিং কথা কওঁ, we are 4 siblings. So my dad is from science background আৰু মা মানে লেখা পঢ়া কৰে. She is basically মানে arts specialty আছিল, humanities. মাই বহুত ড্ৰামা লিখিছিল এণ্ড অল ইণ্ডিয়া ৰেডিঅ'ত কাম কৰিছিল. শ্বি ৱাজ এ প্ৰগ্ৰাম এক্সিকিউটিভ. চ' মায়ে ভাবিছিল যে তাইতো নাই, মই তাইক হিউমেনিটিছতে এটা বাচ্চা হ'লেতো মানে আৰ্টছ ল'ব, মানে হিউমেনিটিছ ল'ব. চ' তাৰপিছত মই যেতিয়া খেলি মেলি আহিলোঁ, অহাৰ পিছত 1 মাহৰ পিছত যেতিয়া মই প্ৰিন্সিপালৰ ওচৰত গ'লোঁ কটন কলেজত, তাৰপিছত তই ইমান দিন কিয় নাই, তেতিয়া মই চাৰ্টিফিকেট দেখা মই ছাৰ মই একদম আছাম ষ্টেট ৰিপ্ৰেজেণ্ট কৰিব গৈছোঁ. ছাৰ মানে অলপ হাঁহি উঠি গ'ল. তেতিয়া কৈছে মই তোৰ মাৰ্কছখিনি চাওঁ. চাই দেখিলে যে তোৰ দেখোন বহুত ভাল মাৰ্কছ আছে, তই ছায়েন্সত কিয় নাযাওঁ, তই ছায়েন্সতো এতিয়াও আছে, আফটাৰনুন শ্বিফ্টত আছে, তই গুচি যা. ডেটছ হাউ আই এণ্টাৰ ইন টু ছায়েন্স. কিন্তু আই ষ্টিল থিংক নট ইভেন বাস্কেটবল, আই এম এ ভেৰি স্পৰ্টছ পাৰ্চন. কিন্তু মই not even মই খুব ইণ্টাৰেষ্টিং যিয়ে স্পৰ্টছ আহে আই লাইক টু টেক পাৰ্ট. লাইক য়েছ, ইভেন গুৱাহাটী মেডিকেল কলেজত মই দৌৰিছিলোঁ, দৌৰাত ফাৰ্ষ্ট হৈছিলোঁ, এণ্ড আই ৱাজ এ কেৰম চেম্পিয়ন. ইউল বি শ্বকড. মই কেৰম খেলিছিলোঁ. তাৰপিছত এতিয়া আমাৰ হস্পিটেলত আমাৰ 14 অক্টোবৰ ইজ এ ফাউণ্ডেশ্যন ডে অফ এ হস্পিটেল. সেইদিনা আমাৰ এটা স্পৰ্টছ ডে হয়, আমাৰ থ্ৰ' বল কম্পিটিশ্যন হয়, কেৰম হয়, বেডমিণ্টন হয়, মই চবতে পাৰ্ট লওঁ. চ' আই ফিল ভেৰি হেপ্পী জানা. And basketball is something very special to me. And আমাৰ এটা assam basketball association আছে, তাতে মই advisor, and তাৰপিছত also I am the president of the Kamrup Metro Basketball Association.
Okay. So you played as a shooter or a defender? What was your position? Okay, you were a defender.
মোৰতো ইমানো হাইট নাই, shooter মানে মোৰতো কল এবাৰ.
তুমি যেতিয়া national খেলিবলৈ গ'লা, so your father was always into academics. So how did you convince him that মই national খেলিম? এটা কেনেকৈ ক'লা?
মোৰ এতিয়াও মনত আছে, এবাৰ মই যেতিয়া নেশ্যনেলছত সেইদিন আহমেদাবাদত আছিলে নেশ্যনেলছটো, মই যেতিয়া চিলেকশ্যন পাইছোঁ, বট মাই পেৰেণ্টছে কেইদিনমানৰ পিছত মোৰ ফাইনেলছ এক্সাম. চ' মোকতো তাৰপিছত মোকতো যাব নিদিয়ে. চ' আই ষ্টাৰ্টেড ক্ৰাইং. আৰু তেতিয়া মোৰ দেউতাৰ ইমান বেয়া লাগিলে. দেউতাই ক'লে অ'কে, ইট ইজ বেটাৰ টু উইপ 1 day দেন টু উইপ ইয়ৰ লাইফ. তই ডিচাইড কৰ বিটুইন ইয়ৰ ষ্টাডিজ অৰ স্পৰ্টছ. আই ট'ল্ড অ'কে. তাৰপিছত গোটেই ৰাতি কান্দি মেলি নেক্সট ডে মৰ্ণিং মই ক'লোঁ না মই যামেই সেইখন খেলিবলৈ, এণ্ড আই প্ৰমিছ ইউ মই দুটাই সমানে ৰাখিম.
Do you still make time to play?
Play means basketball নাই, I am always there. If there is any meeting, কেতিয়াবা গৈ শ্বুট এটা কৰোঁ আৰু. কিন্তু এক্সেক্টলি মই নেখেলোঁ, বাট আই ফিল that some type of activity is important.
You are multifaceted, multi-talented. You were very good in sports also. Doctor, of course, you are a very well-known doctor, and you learned dancing also. Tell us about that.
I am a jack of all, master of none.
You are a master of everything.
তাৰপিছত তাৰমানে সৰুতে মই সৰু ফেচটো কওঁ, আমি খুব এণ্টাৰটেইনিং আছিলোঁ. লাইক উই আৰ 4 children. আৰু মোৰ ডাঙৰ বাইদেউ খুব ভাল হাৱাইন গীটাৰ বজাইছিল, ভাইটিয়ে তবলা বজাইছিল, তাৰপিছত মোৰ মাজু বাইদেউ ভায়লিন বজাইছিল চ' মায়ে কৈছে তাইক কি দিওঁ তাইকতো কিবা এটা দিব লাগে এণ্ড মোৰ মানে মাতটো সৰু পৰা ছফ্ট বুজিছা সেইকাৰণে মায়ে মোক গান শিকাইছিল গান মানে একদম লয় ছয় কিন্তু সেনেকৈ একো নাই আৰু খালি মাতটোৱে টানিব পাৰোঁ সেইটো হা কিন্তু তেতিয়া সেইটো সময়ত মোৰ দেউতা একচুৱেলি পেৰেণ্টছ আৰ ফ্ৰম লখিমপুৰ মানে ইফ ইউ গ' টু ডেট বিহু ইজ চামথিং য়েছ চ' দেউতাই সদায় বিচাৰিছিল যে মই আমি চবেই বিহু ডান্স কৰিব পাৰিবই লাগে বুজিছা তাৰপিছত এবাৰ এনেকৈ কম্পিটিশ্যন হৈ গ'ল মই জইন কৰি দিলোঁ বিহুত এণ্ড আই বিকেম অল আছাম থাৰ্ড প্ৰাইজ মই নিজে শ্বক হ'লোঁ দেই আই হেভ নেভাৰ লাৰ্ণ ডান্সিং
I believe you have stars, winning stars আছে তোমাৰ যিটো বস্তুৱে কৰা হেতুতে you nail it. Okay, let's talk about surgeries now. তুমিতো বহুত surgeries কৰিছা. So এতিয়াও তুমি surgery roomত সোমাওতে OT সোমাওতে do you feel that nervousness tension অলপ হয়নে বা তোমাৰ কিবা প্ৰি ৰিচুৱেল আছে নেকি OT প্ৰি ৰিচুৱেল আছে মানে গান শুনা বা you চাহ একাপ খোৱা just to calm down your nerves?
এক্সেক্টলি সেনেকুৱা নাই টু বি ভেৰি অনেষ্ট কিন্তু মই যেতিয়া অ'টিত সোমাওঁ মই জাষ্ট ভগৱানক কওঁ ভগৱান প্লিজ হেল্প মি বিকজ আই এম টেকিং দ্য ৰেচপনচিবিলিটি অফ দ্য আইজ দ্য ভিজন দ্য লাইফ এনেকৈ চ' ঠিক নাৰ্ভাছো নহওঁ বাট আই ৰিয়েলি লাভ ডুইং অ'টি তুমি যদি কোৱা চইচ বিটুইন এনিথিং লাইক গেমছ লাইক কছমেটিক চাৰ্জাৰী ইট ইজ এনিথিং বাট আই লাভ এণ্টাৰিং দ্য অ'টি এণ্ড আই ফিল মই সদায় মোৰ মানে বাকী কলিগছবিলাকে মই অ'টিত সোমোৱা লাগিলে মই এনেকুৱা মই য়োগা কৰিছোঁ আই ফিল চ' ৰিলেক্স কাৰণ কিয় জানা দ্য মোমেণ্ট আই এম ইন মাই ক্লিনিক ইমান পেচেণ্ট চামটাইমছ আই চি 110 পেচেণ্ট এটেণ্ডেণ্ট হা চামটাইমছ এনেকুৱা হৈ যায় এণ্ড চামটাইমছ আই অলছ' চি এৰাউণ্ড 60-70 পেচেণ্টছ এণ্ড তাতো ষ্টুডেণ্টছ থাকিব বহুত বাহিৰ মানে মানুহ আহি অবজাৰ্ভ কৰিব বেলেগ ডক্টৰ আহি চ' একদম মানে খুব বেছি চব ফালৰ পৰা চাৰাউণ্ডিং কিন্তু অ'টিত একদম আই ফিল চ' হেপী
পিচ
ঠিক নাৰ্ভাছ নহয় বাট আই ৰিয়েলি কনচেনট্ৰেট মানে বিকজ আই ন' that it may be a everyday procedure for me but it is that one day for the patient so respecting the one day of the patient I try to concentrate in every procedure that I do and I speak really less in the OT.
Okay, do you remember your first OT? Do you have a count of how many surgeries you have done till date and in a day how many surgeries you do?
If you ask me the number of surgeries, I have crossed 40,000.
40,000.
Wow, that's a big
wow,
number.
That's a big number.
I have crossed, and if you ask me how many I have done, I think the highest number I have done 31.
In a day?
In a day, but it is not that every day 31, depending what type of surgery. If it is only a cataract surgery, it is fine.
Back to back?
Back to back. But if it is some other plastic related or cancer related surgery, then definitely the list I have to decrease the numbers. At the condition, ajikali lastly bor dekhisa helmet noha koi bike cycle solai. So this is also a message for everyone in the public je jetia bike solai always put a helmet. Kyo koso even a trivial injury, horo injury eta not in the eye, any part. তোমাৰ কি কৰিব যোনটো নাৰ্ভ আছে দিছ নাৰ্ভ কানেক্টছ এ আই টু দ্য ব্ৰেইন এই নাৰ্ভটো ডেমেজ কৰিব পাৰে এণ্ড ইউ মাইট লুজ ইয়ৰ ভিজন ফৰ দ্য লাইফ ট'টেলি চ' তেতিয়া মই আই ৱান্টেড টু ৰিচ ডেট নাৰ্ভ আৰু সেই নাৰ্ভটো মই কেনেকৈ ৰিচ কৰিম ইট ইজ থ্ৰু আ নেভিগেশ্যন ছিষ্টেম নেভিগেশ্যন মানে আমি যে গাড়ী চলাওঁ GPS ছিষ্টেম সেনেকৈ চাৰ্জাৰীবোৰো আজিকালি GPS ছিষ্টেমত কৰিব পাৰে Then I approached my management to Kolu that I need this machine because I really want to help these children. They were a little skeptical iman dummy machine and ultimately they agreed. Jeta moi list dilu je enuka bole Ahomod ba India te iman accident hoy iman khini dristy shakti herai we koribo paru niki. So they got the machine, the institution got the machine. And we are the first one to have this navigation machine in the whole of I should say in the whole of eastern India. এই মেচিনটো কৰি পেলাই তেতিয়া এটা সৰু ল'ৰা এটা আহিছিল তেতিয়া ল'ৰাটো হৈছে চাডেনলি সি এনেকৈ স্কুটি চলালে বা স্কুটি এক্সিডেণ্ট হ'ল আৰু সি নেদেখা হৈ গ'ল তাৰ মই তাক ক'লোঁ যে মই অপাৰেশ্যনটো কৰিম মই যেতিয়া অপাৰেশ্যনটো কৰিলোঁ বিশ্বাস কৰা সি কিন্তু একদম নেদেখে এনেকুৱা হৈ গ'ল হি কুড চি নেক্সট ডে হি কুড চি ফ্ৰম ন' ভিজন টু চাম এমাউণ্ট অফ ভিজন এইটো এটা এনেকুৱা লেভেলত গুচি গ'ল এইটো অল অভাৰ ইণ্ডিয়া or I should say all over the world. We are the first one to do this surgery where we can reach the nerve through the eye using the navigation system and Atomy British Journal is a very prestigious journal that I publish koriso. তে কি ধৰণৰ কণ্ডিশ্যনত এই অপাৰেশ্যনটো কৰিলে ভিজন অহাৰ চান্স আছে বা কি ধৰণৰ কণ্ডিশ্যনত মানে কৰাটো উচিত নহয় so it was something মানে সেই অপাৰেশ্যনটো কৰাৰ পিছত যে সেই ল'ৰাটোক I could give back vision এতিয়া I have done approximately 80 surgeries মই নকওঁ যে গোটেইকেইটা vision আহিছে কিন্তু বহুত কিছুমানৰতো আহিছে
So have you ever been called mid-air? Cabin crew তোমাক announce কৰিছে, is there a doctor on board? And you
Not once.
Then you raised your hands and you said, yes, that's me. So আমি সাধাৰণতে কি কৰোঁ ডক্টৰক emergency হ'লেহে মাতো. So you know it's an emergency. So what was going on in your head at that moment?
এনেকুৱা মাল্টিপল ইনচিডেণ্ট আছে কিন্তু এটা ইনচিডেণ্ট মই ক'ম দেই এবাৰ I was going an international trip দিল্লীৰ পৰা চিকাগো গৈছিলোঁ 2-3খন মুভি চালোঁ চোৱাৰ পিছত বহুত দীঘল জাৰ্ণি ন 14 hours জাৰ্ণি টোপনি ধৰিছে ঠিক শুব লৈছোঁ তেতিয়া এটা এনাউন্সমেণ্ট আহিলে এনি ডক্টৰ ইন দ্য ফ্লাইট চ' লগে লগে হাত দাঙিছোঁ আৰু দেই লগে লগে দাঙিছোঁ তেতিয়া ছোৱালীজনী আহিলে কেবিন ক্ৰু আহি পেলাই কৈছে মেডাম মই ইকনমিত গৈছিলোঁ দেই বিজনেছ ক্লাছত এজন মানুহ এজন আছে তেওঁ বাথৰুমত যোৱাৰ লগে লগে তেওঁ কলেপছ হৈ গ'ল মই কলেপছ হৈ গ'ল তাৰপিছত মই দৌৰি চাইছোঁ পালছ নাই BP ফিবল মানে একদমেই মানে ল' হৈছে এতিয়া কি কৰোঁ তেওঁ মনত পৰিলে আমি মানে হিজ এ মেইল পেচেণ্ট elderly পেচেণ্ট আমি পঢ়োঁ মানে যেতিয়া মানে এজন মেইল তেওঁলোকে ইউৰিনটো যদি হোল্ড কৰি থাকে তেতিয়া ভেগাছ ষ্টিমুলেশ্যন হয় যোনটো আমি ভেছ'ভেগেল এটেক বুলি কওঁ চ' এতিয়া ফাৰ্ষ্ট ট্ৰিটমেণ্ট হ'ব লাগে তেওঁ ভৰিটো উঠাই দিব লাগে এণ্ড ভৰিটো উঠাই দিয়াৰ লগে লগে দ্য ব্লাড ফ্ল'জ টু দ্য ব্ৰেইন অক্সিজেন বাঢ়ি যায় মানুহটো মানে এলাৰ্টনেছ আহি যায় মই তেওঁক মানুহটোক টানি আনিলোঁ বাথৰুমৰ পৰা টানি তাই মোক হেল্প কৰিলে ভৰিটো উঠাই দিলোঁ in the meantime there was another মানে ডক্টৰ ফ্ৰম US সিও তাতে বহি আছিল বিচনাত সি চাগে শুই আছিল নেকি সাৰ পালে তেওঁ গম পালে এনেকুৱা ইমাৰ্জেঞ্চি আছে সিও আহিলে তো মইতো ভৰি কৈছোঁ নো দিছ ইজ নট ভেছ'ভেগেল সি ভৰিটো এনেকৈ নমাই দিয়ে মই কৈছোঁ নো দিছ ইজ ভেছ'ভেগেল মই ভৰিটো উঠাই থওঁ উঠা নমা গ'লে পেচেণ্ট বহি দিলে পেচেণ্টটো যেতিয়া বহিলে এণ্ড ইণ্টাৰেষ্টিংলি somehow I don't look that I'm so old নেকি মানুহটো ডাক্তৰ আৰু পেচেণ্টটো ডক্টৰ ভাবিছে ইমান ইয়াং ডক্টৰটো মোক বচাই দিলে পেচেণ্টে মোক বহুত মৰম কৰিছে দেই ইমানে মৰম কৰিলে তাত বিজনেছ ক্লাছ এটা খালী আছে মোক ইউ কাম এণ্ড চিট হিয়াৰ মইতো ভালেই পালোঁ আৰামছে যাম আৰু 8 ঘণ্টা আছে মই শ্বিফ্ট কৰিলোঁ
Now switching gears a little bit, you and Dr. Harsha Bhattacharjee, both of you make such a wonderful and powerful couple in the medical world. मैंने तो सुना है कि वो आपके प्रोफेसर थे और आप उनकी स्टूडेंट. Tell us about this. Who made the first move? And be honest.
Okay, I'll be really honest. Actually, I met him during the medical college days. After my MBBS, we do a residency program. I was there down there just before my PG entrance. Then my parents used to work. My man hodai koje better to me. Jote ji ase tumi humai jua jate tumi ghor okole thaki mona lage. So there's something called house job or something. And 3 months eta vacancy asil. So I entered in ophthalmology. When I entered in ophthalmology, I have seen that this person is so dedicated. And moi atatko shocked holo. Mane he buys even the mosquito net for the patients. আৰু সেইটো মই এজন প্ৰফেচৰ ৰাও বুলি এজন প্ৰফেচৰ আছিল আপোনাৰ গুৱাহাটী ইউনিভাৰ্চিটি চ' হি হেড অপাৰেটেড ফৰ হিম ৰাতি খানাও বনাই দিয়ে এণ্ড এভৰি পেচেণ্ট মানে চিং হিজ ডেডিকেশ্যন মানে আই ৰিয়েলি গট এট্ৰেক্টেড টু হিম বাট নট ইন এনি আদাৰ ৱে এজ এ মানে গুড হিউমেন বিং তাৰপিছত when I started my my post graduations তেতিয়া মই যেতিয়া ফাৰ্ষ্ট ইয়াৰ আছিলোঁ when I again entered into ophthalmology or as I have already mentioned like I always wanted to be a surgeon or hetu homoy jeta ami PG entrance disilo I could have taken any of the branch also but my parents insisted ba moi bhabsil ophthalmology he also told my parents that yate mane ohomot korile khub bhal it's a good center jodi moi Chennai to sit paisilo Sankaradeva Chennai as for my master post graduation so then when I entered then when I assist him, no, he really likes moi kanike assist koro. He always says that moi to surgical, you have to assist. That is how we became more close. And when he actually proposed me, no, and then moi bhabisu moi ki kori. Mane I was
so who proposed first, doctor?
It's definitely him. And mane moi mane ki I'm the youngest in my family. Moi mane iman heri koi keteo bhaba nasil, but mane khub beshi ta respect asil. খুব বেছি এটা কি মানে সিং হি ইজ সাচ এ গুড হিউমেন বিং মানে ইমান ভাল মানুহ মানে মই ভাবিব পৰা নাছিল মানুহ এনেকুৱা থাকে নেকি So I thought that when he proposed me, it was a very big decision for me. Kan bahut khini amar difference ase, age difference ase, and bahut beleg aspect of difference eta ase. But ultimately, I think that I have taken the right decision.
Then you said yes.
I took time.
You took time?
Definitely, I took time.
Okay. Was he a strict professor?
Very strict.
Yeah.
Very strict. Ekdom amar gali sali parise, gali sali to mo bahut.
And how is he as a husband? Possessive?
Oh, he's very cute.
Very cute.
He is possessive, definitely, but he's very cute, Jana. Mane, he is a visionary. Mane, enuka openly say everything, no? He took moi very aside, and because of his support and because of his vision, mane he always believes in woman empowerment.
Is he a total opposite or your perfect partner in crime?
Total opposite.
Total opposite.
Unlike poles attract. Mane enuka lage we are mane taste and everything is different. Etai khali mile both of us love working and very sincerely we work. Anke amar lifestyle ba khwa everything is different kintu. Teo mane moi ji khai bhal pao he will not like it. Moi jodi junkhon movie bhal pao he will not like it. Totally different.
So who is the calm one?
I think both of us, mane we never fight. Aji loge kinu I'm telling you the truth. Mane supposing I can make out that he is angry, moi ekko mat nei do ekdom chup chap thako.
But sorry.
Mane khong thik nuthe jana, but kiba dislike jeta kore no I can make out from his face. Teta and if I am angry ekdom mat nei die. So kane kache kora nohoy.
Kone সময় পোৱা জানো কাজিয়া কৰিবলে
এটো সময় না
24 ঘণ্টাতে বিজি থাকা তোমালোক দুয়ো
এটো কিন্তু very true একদমই সময় না পাও কাজিয়া কৰিব কেতিয়াবা মোৰ ফ্ৰেন্ডছে কয় না আজি কাজিয়া কৰি আহিলো মই তা ভাবো that is also so interesting না
তোমালোকৰ মি টাইম পোৱা নে ওকে ফাইন আজি আমি মুভি চাবলৈ যাম তেনেকুৱা কিবা
আগেটো চিনেমাই নাচাইছিল এটা মই লছলি কেটা ডাঙৰ হল like he was a pakka vegetarian enuka dhana
oh he's a vegetarian
etia to change ho gol ta mane ki hol jana enuka dhana vegetarian ase garlic onion ekun na khai etia amar ghorot mane eta vegetarian kitchen ase eta mane garlic onion mane nathaka kitchen ase ar tolot amar non veg kitchen eta ase mane mur swali ho jete dangor hol no yete mane ar moi non veg asilo mur ghor to So they are vegetarian kana moi vegetarian hoi gosilu biar pisot kenu yot they have started taking mane more landlady ghot goi khai teta more mother in law college used to stay with us ma mane uporot kyo goi khabo lage lukor kaje ghorote banao that is how mane we started taking non veg
dinner table what discussion do you have do you bring your surgeries and hospital to home
dinner is very interesting full of debates And you should hear because my children are also growing up. I became the mother when I was the first year of my PG program, residency. My first daughter came. And more second daughter when I was in the final year. I had my second pregnancy. So you have to go. It's very nice to hear the debates. Moi to basic debates ibe nokoro kan tinta to ek party. Bujisa. You have to maja jete lage na mur sai khub bhal lage. The younger one no It's very nice to listen to the debates and they do really intellectual gossip.
Tomar mini versions kun do goraki ne? They have followed dad's footsteps.
Thinking process is more towards the dad. Dangor jani looks wise, I think duta na janu mixture.
Yeah. What are they leaning towards? Medicines or totally different dreams?
Dangor jani actually tai ko bhal maths or physics on enuka ase so তাই তোমার কম্পিউটার সায়েন্স ইকোনমিক্স কৰিলে ইউএস ৰ পৰা তাছত তাই ম্যানেজমেন্ট কৰিলে তোমাৰ প্যাৰিছৰ পৰা এটা প্যাৰিছতে আছে তাত তাই চাকৰি ষ্টাৰ্ট কৰিছে কিন্তু সৰুজনী মেডিকেল প্ৰফেশন ললে and ophthalmologist তাই এটা হায়দৰাবাদত আছে
at least you are happy
I'm very happy
and what type of bond do you share with your daughters
oh they are my best friends sincerely I'm telling you Jana মানে enuka lage je mane we are just friends
they inspire you
because every mane sob kotha mukoy they inspire me actually I'm telling you you know they are like we are just like friends aji lage bishwa kor I'm telling the truth yotok moi gali pari poa nai
do the daughters ever feel pressure of being the children of such successful surgeon parents
true you know it's very true my younger daughter especially তাইক মই মানে যেটা কৈছিলো তো ইয়াতে প কিন্তু তাই হেতু খুব প্ৰেছাৰাইজ ফিল কৰে বিকজ unknowingly tai feel kore niki that she is being compared to the parents and all. It's very true kintu. So etiao jodi tai ophthalmology kori ase, I don't know, I want her to come back, kintu ketia ahibo ki koribo moi ekdome tai eku jur dia nai. The day you feel confident you want to come and be with us, work in the same institution, but that pressure I can see her mane enuka lage it has goes. Her name is Pragya Bhattacharjee. Tai keto Bhattacharjee jo nokoy, then no one should know that amare losely what is your name, Pragya, enuka type ho goise.
Wow, Dr. Kasturi, ऐसा लगता है कि 24 hours are also so less for you. You have so much on your plate in a day. When does your day usually start? How does your day usually start?
Yeah, I think like I have to do so much of multitasking and so much happening now. So what, I start my day quite early. I get up around 5:15, 5:30. But the first thing I do is I start the day with my morning prayers. Like even till date, since my childhood, I usually like I lit my diya both morning and night, and I do my prayers at least 4 times a day. That has, I have been doing it from my childhood. So start with the morning prayers, then get ready, then do some exercise. Sometimes I go for my yoga classes, sometimes I do some, what to say, I have a gym also in my house, and also I do some gym. And that is how I start. Then moment by 7:30 I am free, then I need to go to the hospital, be in the hospital, and after I finish my hospital work by 6:30 in the evening, then I need to look upon the administrative part of my hospital, what is happening, going through all the papers, and also associated with multiple, I should say, society related to ophthalmology. Like I'm heading many of the society, both nationally, internationally, so all those works are also coming. So sometimes by the time I reach home it becomes 8, but to be very true, honest, like I don't have a fixed plan, but once I finish one work I think okay, next I have to do this, next, that is
So
what
you do your to-do list in the morning before you usually start your day?
I think not exactly, but
It's all in your
I
brains.
don't do, but I think to do the list is something very important, which I always tell my juniors. Like very interestingly, where did I go very recently? Oh, I went to Paris, and the first thing what I got, I do your listing. There are some nice, I mean, book pads you get. So I get it for everyone in the hospital, especially my HR manager, my administrator, like all this. I always tell you please do the listing. That's so important. But like what I say, like since I don't do, but I do it in my brain definitely.
Yeah, you have a sharp brain.
Not exactly.
You do.
What took you to Harvard in 2021 post-COVID? Was it for some specific training or you wanted to learn more?
See, I feel that in any profession, like we need to learn, relearn, that is very important. But the most important thing, each one of us are responsible for the chair. And this was like in just before COVID, 2019 September, when I was selected as a director. Then the first thing that came to my mind that now I am not only a clinician, academician, I have to take care of the administration. So I am responsible for this chair. So I need to know multiple things. That's how I have entered into this Harvard program. And it's a very nice program where I met many of my friends. Still today we are in very close touch. I also organize this multiple leadership program nationally, internationally. So these Harvard friends, they help me, like they are the faculty for many of my program. So I have really, because I was very poor in finance, I was not knowing, accounts and finance. Like even when I sit in the management meetings of a hospital, whatever the finance, I mean the people, they tell me, I agree to it. But now at least I know what is correct, what is not correct. Like at least I know where I need to put a hole or where I need not put a hole. So finance is something which had really taught me, number one. And number two, Harvard has taught me something very interesting, leadership in crisis.
Okay.
So that leadership in crisis, that is very important, and that is what actually I have learned from them. Like during COVID also, it was such a crisis situation because it was something new for all of us. But how I could manage the hospital during that, I mean that very, that pandemic. So that is something really helped me. It helped me make very good friends. Now I know like some of my friends like to think in a different way. Like, and interestingly what happened, now I have seen that when there was, if you look to the Harvard website also, there I have seen that they have cited me when I was mentioning that seeing things from a different perspective. Like they have asked me what you have learned from the Harvard course, and exactly I am telling you that I have learned to see things from a different perspective, and that is what I feel so happy. They have cited me. If you go to the Harvard medical website, university website, and you know, like I know it's funny to tell you, and what the line comes that famous ophthalmologist becomes a student of Harvard Medical School. Okay. That has really touched me. That means they are thinking that this lady at this age, being
at
a known ophthalmologist, she is again going back to her studies. That's why what they have, I think they wanted to actually project.
Okay. So I want to ask you, how is the learning environment in Harvard different compared to learning in India?
The Indian learning and teaching system is equally good. Like the traditions, the cultures, our perspective is much different. But ultimately, one thing is same for many of the good Indian institutions, like the quality. The quality, whether it's a teaching quality, whatever it is, the quality should not be compromised at any cost. And one thing I have learned in Harvard is that you really need to give back. That is what, like even now also what we see when we meet our friends, when we ask each other what have you given back to the society. Like after doing the Harvard, I realized that I have to further strengthen a rural program, a community program, and what I have initially mentioned, the inclusive growth. But very recently I met one of my friends, so I asked him that what you have given back. Then he told, you know, he's a doctor, but today when he have realized that the agriculture farming in Singapore is little different difficult because of the land may not be as available, so he has started vertical farming. Okay. So there was something like I was really happy, and like that is what, like they have helped us see things in a different perspective, like in the overall growth of yourself and the growth of the community as a whole.
Dr. Kasturi, as you have already mentioned, that Harvard has helped you to shape you as a visionary leader. So, was going to Harvard your second innings to reinvent and reinvest?
Very true. Like it is definitely a second innings, because all these years I was only a pakka clinician or academician. Harvard had helped me develop the leadership skills, and today, initially, like I was only known as an ophthalmologist. But today I get invitation even to talk in big leadership meeting because they want me to share my experience. Very recently I am being invited, I will be going to Malaysia, where they want me to speak on breaking the glass ceiling. Okay. Like for all those things, and but this is that Harvard background, my peers, my professors, my teachers, the confidence they had given me, and they had helped me that behind, like any person who runs any institution, any organization, they should have some knowledge about management, because human resource management is very difficult. Because all the major institution, what they have, this is basically top down approach, but what I believe that it should be also bottom up approach. We need to go to the frontline workers, we need to know what is the actual requirement. Person sitting in an office and not knowing what is happening to the front line can never help in the growth of an institution. So Harvard has realized, made us realize that to take a decision, the first person, the first people you have to ask or take an opinion is from the frontline workers.
Do you think women lead differently and they have something unique to bring to the table? You think women make good leaders?
It's very true, absolutely true. I feel that women are very sincere, they are very accountable, and they take responsibility of the position. But the saddest thing, you know, we women, we need to prove in every step. People, like for everything, what I feel that we need to work extra to be as par with our, other gender. So I feel that at some point, we need to prove ourselves, which may not be for others.
You are playing so many roles. You are truly a change maker. As per you, what is the definition of a true leader?
For me, true leader is one who finds happiness in the growth of others, who finds happiness in inclusive growth, and who really pushes or he tries in the development of others. and who is a good listener, who listens to others and then takes a decision, and who takes the opinion from others, not their own opinion, where every opinion from every sector of the society really matters.
Very well said.
Do you have something in your mind? As for example, you want to be there for the public, you want to showcase your leadership there. Do you want to come out?
I'm happy with whatever I'm doing.
You're happy doing a doctor
I'm getting
role.
a chance to be a good teacher. I have got so many students, India, abroad. Like, I love teaching. Teaching is something I'm really passionate, and whatever I know, I really want to give back. I want that in the next generation they should learn. Like, still I remember, like, when I was just starting my career and when I got my first group of students, so whatever I was giving them, and whatever surgery I was doing, and I made those students do. At that time, many of my seniors went against me, that why you're making them do this type of surgery. I don't know, I'm not leaving them alone, I am with them, because I feel that your next generation is there to take care of you. So, it is so important that you have to train and teach the next generation, and the next generation is always a better generation, is more intelligent. That is what I feel. So, I'm happy like this, being a teacher, mentoring so many people, and doing my clinical work, doing my rural activity. I'm really happy. Like, it's not that I want to be in a very, what to say, different position and take a more stronger leadership. Given an opportunity, definitely I'll do justice to whatever responsibility given to me.
Has anyone come up to you and said that you are such an inspiration, you have changed my life?
Yes, I love when my students, especially, like, my students really, they feel that I am a good inspiration for them, because I still remember once what happened. I was invited to Mumbai for a conference, and I reached, the flight was very late, I reached very late, so night 1:30, and imagine when I landed there, I have seen that there were so many young female doctors along with carrying their babies, 3 months old, for waiting to meet me. So I told, why are you waiting? This is night, like 1 a.m. in the morning. They told, madam, like, we have heard so much about you. We want to meet you personally and spend some time with you. And I was supposed to stay in Thane. So, from the Mumbai airport to all this Marine Drive in the car, which takes approximately 45 minutes to 1 hour, all these women, like doctors, they were sitting in the car only to spend that time, so that I can give that much time to them. And like, it was really touching for me. That time I realized, okay, I'm really helping other females grow, and
you have that aura.
inspiring them.
You have that aura.
Okay. Now we have to talk about something everybody wants to know.
Everybody wants to know. Maybe I should say I'm the first one in the whole of Northeast to start aesthetic surgery and aesthetic practice. I'm the first one in whole of Assam and Northeast to be the first lady FRCs in ophthalmology. I'm the first FRCs examiner from Northeast India to take examination all around, and I'm the only lady ophthalmologist to get the highest scientific, academic and scientific award from the All India Ophthalmological Society. I really feel good, because from Assam, like being in Assam, having education in Assam, working in Assam, my scientific work has been acknowledged as the best in All India forum. And this All India Society, we have approximately 25,000 doctors. Like, there are 3 very prestigious awards known as Colonel Rangachari Award, E.T. Selvam Award, and C.S. Rashmi Award. And till today, I am the only ophthalmologist, female ophthalmologist to get all the 3 awards. Like, I'm feeling shy that I'm telling so much about myself, but I feel happy, because that is also giving a recognition to my state doctors, to my state women. I really feel happy about it.
And it's
That's
making all
moment.
of us so proud.
So proud, absolutely.
Dr. Kasturi, one more thing we would like to know, and all of us would like to know. You are too glamorous to be a doctor. So, are you judged for this sometimes in the hospital?
No, I don't think the patients, they come to me for my skills because they have faith on me. They believe me, they believe my words. But since you're making this question, I feel that many of my junior colleagues, many of my students, they tell me that I'm a role model for them. And in fact, interestingly, we have the Women Ophthalmology Society of India, where I got the role model award also. So many of my students, they say that, ma'am, you are the role model, this and that. But for me, patients come to me for my skills and my honesty, and because the trust they have on me.
Yeah, I believe you are always this stylish and well put together.
Yeah, from my I'm very I like to stay good, and that is also now changing. I want to change the perception. People feel that okay, doctor mane ekdom eneke thakibo lage ene kupa safa mari enuka dhoronor, but I feel that to stay good, to stay smart, it is every profession, it is very important. So I'm always like this kind of ekdom
Well put together.
yeah.
That's nice. That's nice.
You had an amazing journey as an eye surgeon. How did you got into aesthetics?
Aesthetics is a very special branch of oculoplasty. Like if you look to a textbook, if you look to the course of oculoplasty, there are some big fat chapters on the non-surgical, surgical cosmetic surgery, starting from forehead to the chin, and also including the lasers, peeling, everything is there. That's how, because why, I am a teacher of so many students. I have to teach them what is there in the textbook. For that, I need to learn. I have to show them, then only they will be the safe. It is very important to be a safe surgeon, to be a safe doctor. So when I take the responsibility for my students, it is my duty to show them the correct way. That's how I have entered into this aesthetic surgery, doing different types of blepharoplasty, like the lid surgery is a very common aesthetic surgery, and also the non-surgical procedure. So to teach others had developed the interest in me, and that is how I entered into aesthetic surgery.
So it was planned.
It was something planned.
So what is the most common procedure people come to you? Are tumi hodai koro?
Hodai ko besi ki koro jana. Etia mane ki hoise?
In aesthetic.
In aesthetic, the blepharoplasty surgery buli koy.
What is
Ta
this?
mane, if you see the people from our neighboring states, khub Asian lid ase. Asian lid mane they don't have the lid crease, which is known as monolid. So they want the lid crease, and this lid crease we call it double eyelid surgery. It imane common surgery hoise, like many of these young girls, they want to have a little double eyelid so that they all of eye makeup korile it looks good. So this is a very common surgery that we are doing, that is for in the surgical perspective. And non-surgery, we do lots of botulinum toxin, juntu sobe botox boli koy. We do botox, and botox has got numerous functional indication. Manue bhabe mane botox mane okol cosmetic, no, botox is the treatment of headache. It is FDA approved, juntu amar regulatory body. The botox is used for kisun manu suppose inka spasm loi ahe je. Botox is a treatment for spasm.
Headache hole keneke botox, how does it help?
It helps, those patients are chronic migraine ase, even after medicine kono treatment na pai, so then we need to inject botox. There are definitely sites, around 31 sites, including the muscles of the back of the head, and also the forehead muscle, the temporal muscle. And it actually works because it prevents the release of those neurotransmitters, which leads to changes in the blood vessels, leading to stimulation of the nerve and causing the headache. So it is one of the FDA approved recommended treatment for headache. So this is one of the indication. Many people use it for spasticity, different type of spasticity. Jar tumar bachare hog ba manor hog enuka dingi beka ba stiffness pore ase tato botox dia. So kisumane tumar urologist kabar khub hyperactive bladder thake, mane anytime bathroom goi thakibole, that is also a treatment, botox is given. So besides having many cosmetic actually botox what it does, it prevents the wrinkles. Jodi wrinkles ahe, it prevents the action of the muscles, so the muscle just contract karbo na ekane wrinkle to komi jay. So that is the main cosmetic indication. Kan bohotor yat frown lines thake, yat ami crow's feet buli kon tar kane mi use koro ba forehead bohote bhal na pae. So that is, these are some of the cosmetic indications.
So on a lighter note, has anyone come to you with maybe a Deepika's or a Alia Bhatt's picture ke I want to look like this?
This is so common. It's so common, you know. But I want to tell you, actually, মানুহে aesthetic procedure কৰক বা aesthetic surgery কৰক, face to change কৰিব নোৱাৰি. It is only to highlight the features. Supposing they are already beautiful, তুমি অলপ highlight কৰা. That is what you cannot make someone কাবাক গৈ পেলাই দীপিকা নিচিনা কৰাবে আলিয়া. But this type of patients to বহুত, especially in the younger generation, and came sokotu loina, I want this type of eye, muk etu shape eyebrow. But what is one have to do very safe practice, and you have to really give chair time to those type of patient, make them understand, I'll beautify you, like not beautify, I'll make you look more fresh, more young, more rejuvenated. But whatever look you have, no one can change that unless and until you go for major plastic surgery.
All right. Let me ask you one thing. Why is aesthetics so pricey? It costs you a bomb. তোমাৰ এনেকুৱা হৈছে নে কোনোবা আহিছে আৰু সুধিছে কম খৰচতে মুখখন কেনেকৈ ধুনীয়া কৰিব পাৰি? ময়ো ইনডাইৰেক্টলি সুধি দিছোঁ তোমাক।
Yes, it is pricey because
why is it so pricey?
Because it is now one of the most what is trending in the market. So maybe company bilake aru they have not decreased the price. So amar eta advantage, I work in a charitable hospital, so we don't charge much, but still, and because the patient is not the aesthetics are more of a clients, I should say, because they don't have disease, they want to make them more rejuvenated, beautiful. So maybe for that the doctor is a little pressurized because you are working on a normal person. যেতিয়া a diseased person comes to you, he like gives everything you, doctor, what is best you do. But here the patients are demanding, like what you mentioned, they Aishwarya nisna kori dia, Deepika nisna, they are demanding patients. Maybe the doctor needs to give more time, the doctor needs to give more concentration, takes more responsibility, so it's little pricey than the other surgery, like other procedure.
And
right?
Do you think the perception of beauty is changing these days? Like everybody wants to look beautiful or sharp?
I feel that not everyone wants to look beautiful. They want to look young, they want to look rejuvenated, they want to look happy. কাৰণ বহুত মানুহে কয় যে সোনা মোক ইমান টায়াৰ্ড লাগিছে, অমুক লাগিছে, মোক অলপ ফ্ৰেছ লুকিং কৰি দিয়া. So that has really changed. কাৰণ মোৰ মাহঁতৰ দিনতো আমি দেখা নাছিলোঁ. মা was so happy in whatever, like they were taking the aging very gracefully. কিন্তু now everyone has realized that you need to stay young, because people are with this conception that young people are active people, young people are more, what to say, more like productive people. There is still a I think perception coming up. Ekane bote young thakibo bisare, they want to look fresh.
Yeah. A lot of young girls and women look up to women like you, skilled, successful, strong. So if girls are listening to you and dreaming of medicine, what message would you like to give to them?
To be honest, to be focused, to be very, very hardworking, because I already mentioned we need to prove, the females really need to prove themselves, and because what I have told you, we have to break the glass ceiling. We have to break the ceiling to reach to some level. So whatever decision you take in a life, it should be full of honesty, full of dedication, and full of hard work. Because what people say now, say I have aged. So if a young girl will say, she is seeing only the tip of the iceberg. She is thinking that I am this from all these years, but she has not seen my hardship, my failures, like the amount of work I have given into this. They have not seen this, they are only seeing the tip of the iceberg. So we have to make them realize, they should know the truth, that without hard work, without honesty, without discipline, one cannot achieve. To be a good achiever, you must be disciplined, you must give your heart, mind and soul into it.
There is no shortcut.
There's no shortcut to it.
So what's next for Dr. Kasturi? Is there any dream you're chasing?
Any expansion plan?
Yeah, my expansion plan is that I want to develop more academic program, and I want to develop those type of academic program, because where even the people from lower economic class, they can come and get the best of the best education. Because here we are so lucky, being in an urban place, being in a city, so much access to healthcare, education, but it's not there in every place. So what is that I need to develop multiple plans, so that whether it's a certification program or diploma program or some other degree program, so that even, and also I'm talking to multiple NGOs, INGOs, how to get those, especially the female girls from the different remote villages. I can bring them, make them have the education, and they can get job worldwide, like not worldwide, within India, something like skill development. So I want to make all the females very skilled, so that they can stand on their own foot.
One thing you do better than AI.
Yes, that's a very interesting question, because this world of AI now, everything AI has made our life so easy. But one thing which I proudly I can say that I can do better than AI is empathy, number one, and number two, the human touch. That human touch AI can never give. So that is what I think, that till now the AI can never do that, and that every human can understand the human feelings. So that is always we feel that, I feel that the humans are always much superior to AI.
Yes. Okay, you are the president of Asia Pacific Community. Keneke palage taleke?
Etu eta ki jana, etu society ro naam APSOPRS, which is Asia Pacific Society of Ophthalmic Plastic and Reconstructive Surgery. So etu bahut dangor society which includes the whole of Asian countries, right from Pacific jiman ase, including New Zealand, Australia, so ase. So like I wanted to take a challenge. So this time amar Chengdu buli China tata thait asil, like a conference to mane a gathering to once in 2 years hoy, and it's one of a very prestigious society for all people doing oculoplasty work. So I wanted to take up as a challenge. So there was election coming up, and bahut type of bahut dise teoloke nomination dise. So moi tira hoisu na moi di sao. I was not sure that I will get through into this. But jetia bhabilu no tetia pa moi bahut seriously lolo kintu. I had seriously, and I made my CV also very strong. Tar pisot jetia tumar election to hobo, tat jimane contest korise, they are asked to speak that as a president, what is your mission and vision. So exactly Mora got from Singapore, and then when I went and I spoke about my mission and vision, where I want to really develop multiple teaching and training program. I want to work for the young doctors. I want to do multicentric research. The election has happened, and finally I won, and won with a very good margin. So tetia more asur like such a bideshot goi mane I could compete with so many international doctors. And yes, I am also the first female to be a president of this society. So that is how I reached, and whatever I mentioned, you are asking me that 24 hours is less for you. It is very true, because whatever I have mentioned, that I will work for the development of the society, for the academy. I am also arranging multiple master classes. Tomorrow Philippines recently Singapore next month Malaysia, Vietnam, Thailand. So what I know master classes in something which are not there in a textbook, well, which are not taught to the the young generation, but the young doctors, which are not elaborately described or taught in the thing.
Practical.
Yes, so practically I have been doing all the master classes. Quite successful too. So started multiple research also. One definitely on aesthetics, planning to start the second research on thyroid. So whatever I have committed, I am doing it, and that is how I am really getting a good support from all my colleagues, right from Korea, Japan, China, Australia. So we support Korea, and it has become a very dynamic organization now.
All right, one famous personality you would love to do a eye checkup.
Let me cite one male, one female. Female is definitely Lady Diana.
Lady Diana, okay.
Because she is so pretty. For me,
yeah,
she is the most beautiful lady.
She's the epitome of beauty.
And for a male, it is Ratan Tata. Because why, I have already mentioned in the beginning that eye is an extension of brain, and through the eyes we get to see everything. And this man, who happens to be a visionary, who had done so much for the society, I really want to look to his eyes so that I can see the brain, his thinking process, his vision. But both
But
of them are not
unfortunately, both are
gone.
We have lost
But
both of them.
that is, I really wanted, in my life to know exactly how this person's mind has been working, who had done so much tremendously good for everyone in the society.
That was such a fun and refreshing talking to you, Dr. Kasturi. You are such a vibe. Thank you for being with us today.
Thank you so much, Swastika Niladree. I really enjoyed, and to be very honest, this is my first podcast, and I have realized that whatever little I have spoken, hope it reach and a good message to all the upcoming women. And thank you so much for this opportunity. I'm really blessed to have good friends like you all.
And thank you from my side, Dr. Kasturi. It was a joy hearing you, and thank you for making time for us.
Thank you so much.
To everyone listening, hope you all enjoyed today's episode. If you all resonated with Dr. Kasturi's journey, don't just keep it to yourself. Share it, tag us, and spread love.
And of course, hit the follow button so you do not miss out on real stories of real people coming your way. Stick around, we are just getting started.
All right, that's all for today. Till we meet again. In our next episode, we are coming with someone who dared to dream big and travel the world to make it happen.